So many people come to this office, and they are concerned about the shape of their nose. You might be concerned about a hump right about here. You might be concerned about the shape or size or length of your tip. You might be concerned that your nose is crooked or that you're not breathing well through your nose. Those are very common concerns that people have when they ask me about changing the shape of the nose. Traditionally, rhinoplasty surgery was the way to change the shape of your nose, and really there was no other alternative. About 10 to 15 years ago, the term injection rhinoplasty or liquid rhinoplasty came into being. And basically, it is using hyaluronic acid filler to change the shape of your nose by masking certain irregularities or contours that you don't like. So when it comes to changing certain shapes, a lot of people say, Dr. Kim, I don't like the bump on my nose. I want that bump to go away. So if you're not considering rhinoplasty surgery, what you can do for a mild/moderate bump on the nose is you can camouflage the bump by adding filler as a volumizer just above and just below so that you have a straighter profile from the side view. That is the number one way that filler or an injection rhinoplasty can change the shape of your nose. And or you can give yourself just that tiny bit of a perkier tip by applying filler to the tip of the nose. The pros of liquid rhinoplasty are that it's a relatively quick procedure, maybe 5 or 10 minutes in the office with your experienced educated injector in terms of the actual duration of the procedure itself. It takes just a few minutes and it lasts a bit longer than we expect. When it comes to injecting fillers to other facial areas, such as the cheekbones, the jawline, the shape change that we see may last about a year. With injection rhinoplasty, oftentimes the shape change that we see with the procedure lasts quite a bit longer. I've had patients come back 3 years later for a liquid rhinoplasty checkup and they say, I still like it. I don't need the bridge to look any different. I don't need the tip to look any different. And I do think that it's because filler at the tip of a body part is going to be slower to metabolize than, let's say, on your cheekbone or on your jawline, where the lymphatics are a little more abundant. Now, liquid rhinoplasty is not without risk because you are injecting a filler material into a very vascular area. Again, this is very rare, but it can be very consequential, is that if the nose filler blocks lymphatics, blocks blood flow, it can lead to what we call skin necrosis or skin sloughing off and dying, or if there is occlusion of a blood vessel that communicates with the blood supply to your eyeball, it can lead to blindness. And this is something that the provider as well as the patient must recognize and treat very quickly. So I perform these regularly at the office. And again, the two most common concerns that I can help you with in terms of an injection rhinoplasty is to camouflage a bump that is on your nose. And the second thing is to make the tip of your nose a little bit pointier, maybe perk up just that little bit. And I love doing this because patients see it right away in the chair. You give them a mirror and they say, wow, that's a new nose, that's me, that's really cool.